Good morning students. Now in this session we will study about MTP and sexually transmitted diseases. Now first of all, what is this MTP? The full form of MTP is medical termination of pregnancy. Now for which females it is allowed? MTP is now being legalized and it is for the females for whom they want that the pregnancy is unwanted or such pregnancy is the result of the rape case, or after the sonography the particular female, it is known that the developing embryo is having some kind of disease, or itself the particular female is having or experiencing some kind of STDs and other disease. So in that case, particularly MTP, it is regarded as a legalized one to the females. Now in simple terms, it is defined as intentional or voluntary termination of pregnancy is called medical termination of pregnancy or induced abortion. 40 to 50 million MTPs occur every year in world, which ultimately decreases population. But this is not the reason that MTP it is considered in order to decrease the population. It is accepted and it is legalized, and it is also debated due to the several reasons such as emotional, ethical, religious and social issues. Government of India legalized this MTP in 1971 with strict restriction to check indiscriminate and illegal female foeticide. Now why this has been considered? Because sometimes by the name of MTP, those particular family, those who are not just favoring for the girl child, so one or the another reason they are giving and they are just planning for the MTP. So in order to avoid all such particular illegal actions, strict guidelines are made for the MTP. So these are the following reasons in which condition MTP should be done. MTP is done in order to get rid of unwanted pregnancy due to unprotected intercourse. Second, failure of any contraceptive methods. For example, we have seen in the previous session various contraceptive methods we have seen. So it may happen that during the time of the copulation, if the particular couples they are using the contraceptive methods, but suppose in some cases the contraceptive method fails, so it may result due to the pregnancy. Then in case of rapes, then pregnancy which may fatal to mother and fetus. Mother and fetus means either the mother is experiencing any kind of disease or the particular developing embryo is having the any kind of genetic disease. So further it may be more dangerous to the child in the future days, that it may develop the severe particular symptoms of that disease and the child survival is at risk. So in all these cases MTP it is considered. Otherwise there is a strict check that those couples, those who are not favoring for the girl child birth, for those couples there is a strict guidelines. Now when this MTP it is done, this method it is safe and it should be done within the first trimester, that is within the 12 weeks of the particular pregnancy. In the second trimester, abortions are much riskier and it is not being particular favored. Illegal unqualified quacks, unsafe and fatal, that is avoided by counseling. Now many of them people that are staying in the rural areas and many other unqualified persons, they are having many unuseful talks about this MTP. So these are all eradicated by proper counseling methods. Next topic is sexually transmitted disease. shortly written as STDs, diseases or infection which are transmitted through sexual intercourse are called sexually transmitted diseases. They are also known as venereal disease, that is VD, also known as reproductive tract infection, that is RTI. Now, which are those diseases? These are the examples given. First is gonorrhea, which is caused by Neisseria gonorrhoeae. Second is syphilis, which is caused by Treponema pallidum. Third, genital herpes, that is caused by herpes simplex virus. Chlamydiasis, that is caused by chlamydomonasis. Genital warts, that is caused by human papilloma virus. Trichomoniasis, that is caused by Trichomonas. Hepatitis B, which is caused by hepatitis B virus, and HIV/AIDS, that is again caused by human immunovirus. So these are the sexually transmitted disease. They happen due to the particular sexual intercourse, or whenever the particular one individual is already experiencing with this disease and it is he or she is mating with the particular another partner, so the chances are more are that the other partner can get the such type of disease. Now, what are the mode of transmission is there? That is in the case of hepatitis B and HIV, that is sexual contact with the infected person, that is either the single person is having, and if the other person is maintaining the sexual relation with that person, then that person definitely will get the such type of disease. Second, sharing of injection needles. Sometimes it happens that nowadays the needles, they are being, once it is used it is discarded. In the previous time might it happen that once the needle it has been used and we are not checking that that person is having severe disease or not, so in that case if the needles are shared, then such type of disease can be transmitted to the other person. Third, sharing the unsterilized surgical instrument. Now, proper care of the surgical instrument are maintained, proper sterilization methods are there. So, this is the rare case in which this tap is happening. Fourth, transfusion of blood from infected person to healthy person. Whenever blood transfusion procedure takes place, it is must that we have to check all the details of that person, that that person is healthy or not, so that no such problem occurs. And last one, infected mother to the fetus. If the particular mother is infected and she is having in her womb the developing embryo, then the embryo after the birth may not survive for a longer time. So particular it is the method, or it is the advice given to the mother either to go to MTP, or if she wishes to give the birth to the child, then all the consequences are informed to the particular mother. Except hepatitis B, genital herpes and HIV infection, others are curable by special medication. Now, what are the symptoms in the earlier stage if the particular person gets infected with any kind of this disease? First is itching, fluid discharge, slight pain occurs, swelling in the genital region. Second, STDs remain asymptomatic in female and remain undetected for long. Asymptomatic means no symptoms are seen on the body for longer period of time, and after a period of time one or two symptoms we can see, and if the particular individual is not paying attention to that, then it can get into the severe cases. And third, in the later stage it may lead to the pelvic inflammatory diseases, also known as PID, which may lead to the abortion, stillbirth, that is the dead child is born, ectopic pregnancy, that is the particular embryo is placed somewhere other than the uterus. It may also lead to the infertility or even cancer in the reproductive tract. So if any of the small symptoms are seen in the reproductive region, one must contact to the doctor as early as possible in order to avoid all such situations. Now, what are the prevention for this STDs are there? Avoiding sex with the unknown partners or multiple partners. This is the most important point one has to remember. Second, always using condoms during coitus. Third, in case of doubt, consult a doctor for early detection. Getting complete treatment for diagnosed disease. Once the particular disease has been diagnosed, you have to take care of your hygiene of the reproductive organs. You have to take proper medication. Only then the STDs are curable. And in future also, we have to take care of all these points. So I hope students, STD topic, that is sexually transmitted diseases, and MTD, that is medical termination of pregnancy, is clear to you all. If you have any doubt, then please you can mention in the comment section. Thank you.